Part 2.
This is from loperamide, aka
Just to
Immodium
review,
AD.
your 43-year-old female
She
patient who arrived in
overdosed
the
on
ED
it,
with
guys.
complaints
Listen
of
to her video.
syncope
Listen
times
to her.
one day, who was alert and oriented on arrival and in sinus rhythm, spontaneously went into VTAC and cardiopulmonary arrest, only to spontaneously come back out of it, and is now alert and oriented and talking. What's going on? As I mentioned, this patient has the suggestion of an opioid use disorder. You should look into that. That's your clue. And yet you ran a tox screen and nothing's wrong, right? But you are smart. You remember it was something about opioid withdrawal and an over-the-counter medication. An article about people in opioid withdrawal abusing loperamide, also known as Immodium. And you wonder if maybe that's it. Patients who abuse Immodium and loperamide use it in extremely high quantities, 100, 200 tablets at a time. And over time, this drug causes cardiac conduction issues, and it's undetectable on a standard tox screen. So your tox screen at the hospital is useless for it. You think this patient might be using it because one of the classic signs is a rare arrhythmia called torsade de pointes, which looks like this on an EKG. It's a senseless, chaotic rhythm, and it's very classic. So ask your patient. Ask them how much of it they're taking. Their life depends on it. Follow ACLS protocol and contact your poison center. They will have the most up-to-date information on how to proceed. And how do I know all this? I've mentioned before that I am a nationwide expert on loperamide abuse. I work with national agencies to try to prevent the use and abuse of this drug. I was also the first case. I know loperamide is no joke because I lived it. I'm not proud of that fact, it just is. I died that day 28 times. I was cardioverted and defibrillated 28 times. Wide awake and lucid for the experience. I was on life support for 3 days. Most of the protocols that they have now were developed based on what they learned from me. I've been clean since 2013 of all drugs. So when I say I know what I'm talking about, I know what I'm talking about. I'm now on a nationwide panel of experts advising the CDC and the FDA as well as drug manufacturers. And I'm a nurse. Because that day I decided I wasn't going to die. And I died 28 times. Recovery wasn't easy, but it's possible. It's always possible. I'm on borrowed time, and I'm trying to use that time for good. So if you're a doctor or a nurse in an ER and you see a patient showing up with these symptoms, remember what I just told you. You'll be smarter than everyone else in the room, and you will have learned it from me.